Hello mamas. So if you've been experiencing swelling in your lower extremities during a third trimester of pregnancy, then this video is for you. Let us do a quick 10 minutes routine to help reduce the swelling which happens in our lower extremities because of the increased fluid volume and retention which happens because of the growing uterus in the third trimester. So let's get started. Remember, if you've been experiencing breathlessness or dizziness or any kind of discomfort, always talk to your healthcare provider and get a clearance before doing so. So, before we get started, I would begin by sitting in a comfortable cross-legged position, okay, upright, and let us get first moving our hip joint in small circles clockwise 5 times and then anti-clockwise 5 times. Remember to breathe easy, and at any point you feel any discomfort, you can just stop exercising and rest. After we're done with hip circles, let us sit with our feet extended, okay? Take a nice support behind. Keep your back upright. Remember, no straining the abdomen. Once you're comfortable, let us do some clockwise rotations of the ankle and few anti-clockwise rotations. You can do both of them 10 times. Once we are done that, let us do the inversion and external version of our hip joint and the ankle joint for 10 times, or as many times you feel comfortable doing so. Some dorsiflexion and extension of the ankle joint, again 5 to 10 times, or as you feel comfortable. Breathe steady and slow. Once we are done this, let us now flare our toes and curl them. Flare as much as you can and curl them. You can do this movement 5 to 10 times. Remember, the more movement you do, it will enhance the circulation in the lower extremities and reduce the swelling. So once we are done doing that, let us move to a knee joint. You can take support of the leg, hold your tummy and make circles clockwise and anti-clockwise. Again, I leave the count to your comfort level. I generally do them 10 times each side. Once we're done with the knee circles, let us now move our attention slightly above to our hip flexors. So I'm going to sit again nice and tall, lean a little bit backward, take support of my hands, and I'm going to do slow leg taps. Ten times each side or as per your comfort. Okay, so once we've done this, let us now come into a butterfly pose. Open our hips a little, rock a little side to side, and then Do the hip flaps, the butterfly flaps. Get some blood moving to your hip flexors, to your pelvic joint. Once we do this 10 to 20 times, let us sit and do some 90-90s movement. Move as per your comfort. See how much your joint is mobile and move easy and fluid. Once you're done doing this 10 times, you can now move into a nice easy tabletop position and just get little comfortable here. Let the weight of the uterus come off your back and let your spine breathe and relax. Let us make some hip circles 5 times clockwise, 5 times anti-clockwise. Once in the center, let us do some anterior and posterior hip tilts. Nice and easy. Rocking the little baby. One cue, whenever you're on tabletop position, try to brace your abdomen, hugging in the baby instead of letting it fall down. Okay, so just hug in your baby and do the tilts. Once we are done with 5 to 10 counts, let us do the full cat and cow. Inhale, look up. Exhale, get into the cow. Once you're done doing 5 to 10 counts of the cat and cows, let us now extend our hip, get into a comfortable position and slowly take your leg off and pulse. You can do it 10 times each side or as per your comfort level. Remember to press the floor and brace your core while you do so. From here, let us get into a couple of supine exercises. But again, if you feel dizzy or uncomfortable at any point in time, just stop the exercise. Get onto your left side, slowly get down and lie on your mat. From here, once you feel easy, let us do some pelvic lifts or the glute thrusts or the pelvic bridge, whatever name you feel comfortable. So inhale, go up, squeeze your glutes, hold your baby, exhale, come down. This is also an excellent pelvic floor exercise. Once you're done doing this 5 to 10 times, let us train our core a little bit. So we're going to get into some dead bugs. So hold your hands, support your other knee on the mat, and I'm going to take my opposite hand out, and as I bring this in, I'm going to do on the other side. Remember to be nice and steady. You can do this 5 to 10 times on each side as per your comfort. Once we are done doing this, let us slowly get into a left side and come up. From here, let us do some calf stretches. So I want us to get us into a nice low lunge. If you feel the need to support your back leg, you can always use a soft cushion or a towel below your leg. Once you are in a lunge, we're going to do a nice calf raise. Five to 10 times each side. You can take the support of the wall, support your tummy, and slowly and easily move. Again, 5 to 10 times each side. You can also do the calf raises in a standing position and get the movement as per your comfortable. Remember, the swelling will come down as much as you move and more circulation happens to the lower extremities. So hope this was helpful and thank you for watching. Like, share and subscribe to